Okay, and then this is the OpenStax, and they talk. This is a funny thing about OpenStax. It's been pretty good. I think OpenStax overall this semester has been pretty easy. Now it's talking about second degree and third degree blocks. I think that's borderline yeah, I think that's maybe more appropriate for Dr. Merritt's advanced A&P class. But let's start off with the basics here. But let's refocus on ventricular tachycardia. So why is VTach, as someone mentioned in chat, kind of like concerning? Well, the thing is that if ventricular tachycardia goes on for a long time, what it can result in is something called Vfib, or ventricular fibrillation. And notice that, look at the peaks. They no longer have that sharp QR waves in the Qrs complexes. And look at the overall rhythm. So let's go back to top hat. Now for top hat, it's going to be a click question. All right, so what I want you to do is click on any P wave in this image. Okay, let's see the heat map of what people responded. And yeah, look at where people were clicking. So, all right, I'm going to hold off on answering that one. Now try to click Qrs Complex. Okay, let's look at the heat map. And so, did you find that confusing? It is confusing, right? And what's the right answer? Yeah, you can't really distinguish clear PQRST waves, and that's typical of ventricular fibrillation. You see some activity, you see this big wave-like activity, but you don't see the normal tracing of an ECG. So that's what Vfib is. You have this electrical activity, but you don't have those clear PQRST waves. Yeah, so that's what we have with ventricular fibrillation. Now the depolarization of the ventricles becomes erratic. So one great analogy that one of my colleagues used, he said it's almost like a seizure of the conducting system of the heart. So you have electrical activity, and if you've ever seen someone who has an epileptic seizure, they can't really voluntarily move. They're kind of frozen in place. So you have electrical activity, but now the ventricles can't contract in an organized manner. So there is electrical activity, but you can't have that kind of coordinated contraction and relaxation. Therefore, this is why Vfib results in no pulse. If the heart can't do complete contractions and relaxation, how is it going to pump water? Or another way I like to think of it, it's like thrashing and in the water, but is it actually swimming forward and moving water? Not really. So it's kind of like someone who's drowning but not actually moving and swimming. So what happens is it usually leads to cardiac arrest if you don't resolve this. So what is cardiac arrest? It's a sudden stop in heart function. So your heart just stops functioning altogether. So the thing is that it's deadly because, again, you need to supply oxygen, especially to your brain and your heart itself, vital organs. And the survival, this is why it's also not just it's not only stroke that needs to be acted upon very quickly. Cardiac arrest, you have to do this resolve it as soon as possible. You have to do something. And this is why living on a high floor could be hazardous to your health. Take good care of your heart if you live on a high floor, because if you live in a high floor, and I think it was anybody above the third floor in this study, only 4.2% of patients survived their discharge from the hospital. So yeah, cardiac arrest, time is essential. It's not just on the order of minutes. It can be sometimes seconds. So yeah, and above the 16th floor, less than 1% survived, and above the 25th floor, nobody lived. So this is why living on a high floor can be potentially hazardous to your health. So if you live above the 25th floor, take good care of your heart now, because again, it's not looking good. And this is the thing, is that what you want to do is get someone intervention as soon as possible. Get someone to the hospital if their heart stops, because again, the longer it stops, the less likely they'll survive. Now, it's interesting too, because for people who suffer out of hospital cardiac arrest, even if they survive, most of them severe some sort of neurological impairment, meaning that their brain has been damaged from being starved of oxygen and nutrients during that time. So again, this is why if someone's heart stops, you have to get them to the hospital as soon as possible.